You know, obviously we're in Thanksgiving week, and this new poll came out. It said 1 in 3 parents say that family holiday gatherings are worth the risk of catching and spreading COVID-19. A third of the parents believe the benefits of getting together is worth that risk. So this poll was just published yesterday, and despite the fact that 9 out of 10 people said grandparents, which obviously is, you know, one of the highest risk groups for severe infections, were typically at their Thanksgiving gatherings. We actually put this poll out to the people that join our conversation each day to see how they were feeling about it. And, you know, I guess it just begs the question of, and here are their responses right now. We're at 54% saying no, it's not worth the risk, but 10% still didn't decide on this, whether or not it's worth the risk. So we're at Tuesday. We're looking now, you know, just hours away from Thanksgiving, and people have a very important decision to make here, Dr. Hotez.
Well, you know, part of the problem is the CDC was not as quick on the draw on creating this public health message as I like. I mean, in some cases, people are learning about this after they've already purchased tickets and made holiday plans. But here's the reality. The reality is there is a screaming level of virus transmission going on nationally. And now Georgia Tech has put out this interesting assessment tool where you can look at different parts of the country where people are coming from and where you're going to have Thanksgiving based on the number of guests and the likelihood that somebody with COVID-19 will be at your table. It's up on my Twitter feed from this morning if you want to take a look at it. But, you know, there's so much transmission. What happens is as you get numbers up there, you know, especially if they get up close to 10, because over the summer we kept on hearing gatherings of no more than 10. 10 won't cut it anymore. If you have 10 people at your table, depending on where in the country they're coming from and where in the country you are, you will have COVID-infected individuals at your table most likely, and that's the bottom line, number one. And then the other piece to this is, remember, they're going through airports, they're going through bus terminals, they're going through train stations. Anytime you see big crowds of people, I guarantee you there are COVID-infected individuals in that train station. So this is not the year to do it. Vaccines are coming. Just stay disciplined. I know it's very sad not to see family. I mean, I had to tell my oldest daughter, who was going to drive with her husband from Los Angeles to Houston, I had to tell her, Emmy, don't come. You know, you'll get COVID, you'll give us COVID. We'll figure something out after we all get vaccinated. And same with my son, who's in Tucson, Arizona. You know, don't come. And that's hard for a parent to do, right? I haven't seen them since January. Very sad for my wife, you know, who hasn't seen them. So, but there you are. That is the reality right now. But again, it's not forever. The goal is to get everybody to the other side, right?
And if you want hindsight, right, you can look to the north, to Canada. They already celebrated their Thanksgiving, and now they're seeing a spike, you know, in the time that followed it. Theirs is in October, and Canada had 185,000 cases, and only 6 weeks later, that number's nearly doubled there.
Yeah, that's right. This will be a large super spreader event on top of what we already have, which is massive levels of transmission. Remember, we're already up to 200,000 confirmed new cases a day. We'll be up there very soon. And that's also an underestimate, probably by 4 or 5. So for all we know, we have 1 million new confirmed cases every day in the United States. And so this thing is snowballing in a very terrifying way. And I say terrifying because once you get that level of transmission, the thing you worry about are surges on our intensive care units. And that's when the mortality rates really skyrocket.
All right, we're